Fungi are everywhere. It's estimated that there are over 1.5 million different species of fungi on Earth, but only about 300 of those are human pathogens. Fungal diseases are called mycoses. The singular is mycosis. In this video, we'll take a look at some of the most common mycoses. Your objectives for this video are to classify fungal diseases and describe some common fungal mycoses. So, I already told you this information. I told you that there are about 1.5 million different species of fungi on Earth, but only about 300 of those are human pathogens. If you're like me, you probably wondered why such a small number of fungi infect humans. Well, in order for a fungus to cause disease in a human, it must be able to grow at high temperatures. Remember, our body temperature is usually around 37 degrees Celsius, so that's 98.6 degrees Fahrenheit, a high temperature for many fungi that live in our environment. In addition, the fungus has to be able to reach suitable tissue that it can grow in. It's got to be able to absorb nutrients from human tissues. This implies that it has a certain set of enzymes that can recognize our proteins and carbohydrates and break them down for use. And then kind of the fourth thing that these fungi have to be able to do is they have to be able to avoid the human immune system. Most environmental fungi can't do all those things, especially tolerating 98-degree weather every day. So that's why there's such a small number of fungi that are responsible for human disease. Fungal mycoses are classified 3 different ways. The first way is how they're acquired. Exogenous mycoses are acquired from the environment. For example, fungal spores may be inhaled in a dusty environment. In 2018, there was an outbreak of coccidioidomycosis, which is also sometimes called valley fever. When a group of U.S. volunteers traveled to Mexico to build houses as part of a service project, and then they started returning back to the U.S., 2 high schoolers on the trip were hospitalized with pneumonia. When their symptoms didn't improve after treatment with antibiotics, doctors took a closer look and determined that the students had valley fever. The CDC got involved and found that over 133 people from 4 different states had been on that trip. After more investigation, they tracked down the other people who worked at the same site as the high schoolers and had been doing jobs that involved frequent contact with soil and kicking up dust from the soil. After lots of testing, interviews, and follow-up, the CDC found that about 1/3 of the travelers reported symptoms of valley fever or tested positive for the fungus. They had likely inhaled fungal spores, and the coccidioides fungus began to colonize their lungs. So, contact with the environment can transmit some mycoses. Another way that fungal diseases can be transmitted is through contact with the skin or nails. A onychomycosis is a nail fungal infection that can be transmitted in nail salons when tools or soaking tubs are not properly disinfected between clients. When a technician uses clippers to cut the nails that are infected with fungus on one client, and then the fungal spores aren't killed before the tool is used on another client, fungal disease can be spread. Another common exposure to spores happens when needles and puncture wounds deposit fungal spores beneath the skin. This is called the parenteral route. In all of these cases, the fungal spores were in the environment, and somehow they were delivered to the body, either via touch, inhalation, or by damage or trauma to the skin, like a prick or a puncture. A fourth, less common way that exogenous fungal mycoses can occur is through ingestion. Endogenous mycoses come about when fungi, yeast specifically, in the normal flora are favored for growth over bacteria. For example, some women develop vaginal candidiasis, aka a yeast infection, when the bacterial flora of the vagina is reduced due to antibiotic treatments. This leaves the yeasts behind to metabolize any sugars and nutrients that would have been consumed by the bacteria. And as a result, the yeasts bloom and grow out of control, causing inflammation. A second way that mycoses can be classified is virulence. Remember, virulence is how easily a microbe causes disease. The more virulent a microbe is, the more easily it causes disease. Primary pathogens make normal, healthy individuals ill. These pathogens are usually dimorphic fungi, and they infect people usually through the lungs or GI tract. Then from there, the fungus grows and it can spread to different organ systems. Occasionally, primary pathogens enter the body via the parenteral route, so through an IV line, an injection, or maybe it's through the placement of a catheter or some other medical device in the body. Opportunistic pathogens are those pathogens that are part of the normal flora, usually, but they can also be out in the environment. But they only cause disease in individuals with compromised immune systems or pre-existing conditions that may predispose someone to an infection. So examples would be people who have HIV/AIDS and thus have a weakened immune system, or maybe they are on immunosuppressive therapy, maybe they've had cancer and their immune system is weak because anti-cancer drugs target quickly reproducing cells, and immune system cells fall in that category. Maybe someone had an infection already and they're trying to recover from that, but they get a secondary fungal infection while their immune system is weak. Maybe they're malnourished. Maybe they have a predisposing condition like COPD or emphysema or tuberculosis. The third way that fungal mycoses are categorized is by where they occur in the body. And this is the primary category that we're going to use for the rest of this video. So the first category are the superficial mycoses. These are fungal infections that are localized to the skin, the hair, and the nails. A subsection of this or a subcategory of this would be the cutaneous mycoses. So these are fungal infections that happen in the keratinized. So those are the most superficial layers of the skin as well as the hair and the nails. Usually your cutaneous mycoses don't invade living tissues, but if they aren't treated for long enough, they may. Subcutaneous mycoses are fungal infections that are localized to the dermis of the skin or the subcutaneous tissues or adjacent tissues, structures like muscle or bone. The final category is the systemic mycosis. So your systemic mycoses are deep infections. They involve internal organs and sometimes more than one organ system. So these infections might start out in the lungs, but then they travel to the brain or the kidneys or the spleen, maybe even the skin. So now let's talk about some fungal diseases. We're going to start with the superficial mycoses. Remember, these are fungal diseases that are confined to the outer layers of the skin, hair, and nails, and they rarely invade living tissues. You need to know that superficial mycoses can be acquired two main ways: through direct or indirect contact with dermatophytes. Dermatophytes are fungi that are capable of producing enzymes that break down the keratin. in our hair, skin, and nails. Direct contact means that you directly touch the infectious agent. Think about, for example, when you have a cat or a dog and they have a ringworm infection, and then they rub up against your leg, and a few days later, your leg starts itching and you have a ring-like lesion on your leg. That would be direct contact because the fungal material was deposited directly on your skin when your animal rubbed up against your leg. When fungi are transferred from animals, then that's called a zoophilic transmission. Indirect contact means that instead of actually touching the fungal material directly from someone who's infected or an animal that's infected, you touch some inanimate object that they touched. Think about the gym, okay? And you go to the showers. Hopefully you wear shower shoes. If you don't, you're setting yourself up for a potential athlete's foot infection because someone who has athlete's foot may walk across the shower floor depositing spores and fungal hyphae on that moist surface. Then when you come walking behind them, you pick that material up on your feet. And if you don't dry your feet properly, they can develop into a fungal infection. When we acquire a fungal infection from other people, it's called anthropophilic. Anthropophilic. This is an example of indirect contact, the gym floor example, because the floor is transmitting the fungus, but it's a non-living object. We can also pick up fungal infections from soil, in which case those are called geophilic. So on the last slide, I told you that your superficial mycoses are usually coming from fungi called dermatophytes. And there used to be a commercial for a drug called Lamisil, and Lamisil treated nail fungus. And they had a dermatophyte called Digger the dermatophyte. I've put a video for one of those old commercials in your lecture videos folder. But this is what dermatophytes really look like. Kind of different, right? What we're looking at are spore-forming structures for 4 types of fungus that transmit athlete's foot. So you have epidermal phyton for flocosum here, and this is the 3rd most common fungus responsible for athlete's foot. Notice that it says anthropophilic. What does that mean? Right, it means that this is transmitted from person to person. Okay. Next we have Trichophyton rubrum here. This is the most common cause of athlete's foot, and it's also anthropophilic. What does that mean? It's coming from a person, so that person who leaves the fungus on the gym floor, okay, that's anthropophilic transmission or an anthropophilic source. Microsporum gypsum is another common transmitter of athlete's foot, so people walking around barefoot outside, okay? And this is geophilic because soil serves as the source of the fungus. Then we have Trichophyton mentogrophytes. This is your 2nd most common cause of athlete's foot, and it's another anthropophilic fungus and anthropophilic transmission. Do I expect you to remember all of these? No, it's just for your personal information. Ringworm is probably the most common superficial mycosis that we find in humans. And ringworm goes by a number of different names. It's sometimes called athlete's foot when it's on the foot, like you see here in this image of the plantar surface of someone's foot. You can see the skin is all crusty and rough. When it's in the groin area or between the breasts, then a ringworm infection is called jock itch. Ringworm infections are also sometimes called tinea, and it can also be called dermaphytosis. There are other names as well. When the ringworm infection happens at the scalp, then it's called tinea capitis. When the ringworm infection happens like on the legs, the arms, the torso, some body part, then that's tinea corporis. On the hand, ringworm infections are called tinea manus. When it happens in the nails, then the infection is called onychomycosis. Jock itch, that ringworm infection of the groin, is called tinea cruris. And then athlete's foot, ringworm infection of the foot, is called tinea pedis. And again, there's a number of fungi that are responsible for causing ringworm. Two things that I expect you to remember. Well, three things that I expect you to remember. Number one, ringworm is a fungal infection, not a worm infection. Number two, it goes by a number of names, but athlete's foot, jock itch, and tinea, those are all referring to ringworm. Number three, there's a number of fungi that cause this infection, over 40 different species. I named a few of them on the previous slide, but just know there's a lot of them out there. As I mentioned, superficial mycoses are picked up via direct or indirect contact. Remember, in direct contact, you actually touch the fungus somehow. There's direct contact between a susceptible host and someone who's infected. Indirect contact means that there's some inanimate object involved. I mentioned the gym floor a little while ago as being a possible transmitter for athlete's foot. That's an example of indirect contact. Let's say you have someone who has a ringworm infection of the scalp. They have tinea capitis and they've got hair loss as a result. When they run the comb over that lesion, hypha and spores wind up on the comb. Then if you use the comb to comb your hair, you transfer the fungus using the comb. So that's another example of indirect contact. Using a towel after someone with a ringworm infection can also be another method of indirect contact. So the signs and symptoms of a ringworm infection, typically there's going to be itchy skin. And when you look at the skin, it might look scaly, crusty. Typically, you'll have a ring-shaped lesion like this or rash. The skin, if you think about athlete's foot, might be red, scaly, and cracked as well. When ringworm infections happen on the scalp, it's often accompanied by hair loss. And when we're talking about onychomycosis or a ringworm infection of the nails, usually the nails become thicker, they become discolored, and they don't really cause any problems for the sufferer, but if they're not treated, abscesses and cellulitis can result. Another superficial mycosis would be pityriasis versicolor, which is also sometimes called tinea versicolor. This is a common fungal infection that interferes with the normal pigmentation of the skin, as we're going to see in a few minutes. You might call this an opportunistic infection. It occurs when yeasts that are part of the normal flora, like Malassezia globosa and Malassezia furfur, start to grow out of control. So again, this is an opportunistic pathogen, and it's a yeast. And this mycosis occurs when the yeasts that are part of the normal flora of the skin grow out of control. The overgrowth usually occurs when someone is in a hot and humid environment for a long period of time, or it could happen in response to oily skin or hormonal changes. Tanning can increase the visibility of the mycosis. So someone might have it, and it's not until they go out and tan and they're sitting under the hot sun and sweating that you get a little bloom. And because of the tanned skin, you see the, the rash that results. So typically the rash uh, causes mild itching, the skin may be kind of scaly, and what's very much characteristic of this infection are these discrete, confluent, sharp-edged plaques on the chest, on the back, on the arms, and potentially on the neck. They can be hyperpigmented, like these, so the little plaques, the little circles are dark in color, or they can be hypopigmented, like these, so they appear light in color. And it's the hypopigmented ones that you usually see really well during tanning. This type of infection is more annoying than anything else. It's treated with antifungal creams, also lotions, and sometimes shampoos. Now let's look at an example of a subcutaneous mycosis. Remember, subcutaneous mycoses affect the dermis and the subcutaneous tissues, like muscle and sometimes bone. These types of infections are acquired parenterally, so that means there's going to be some sort of traumatic puncture to the skin. So we're going to talk about sporotrichosis, or rose gardener's disease. It's caused by a common fungus called Sporothrix schinkii. And just a warning, the next several slides will have what some people may consider disturbing images, but if you're planning on going into healthcare, you should be able to watch these without being affected by them. All right, here we go. This is what a Sporothrix infection looks like. So the way that this is acquired is when spores from the fungus are in the soil or on plants or on decaying vegetation, like in someone's garden, and someone goes out and works in the garden. Then they get a cut or a scrape, or maybe they're working with thorny bushes and get a puncture, and this introduces spores to the subcutaneous tissues or the dermis. The fungus then begins to grow and it begins to spread along lymph channels. So if you look at this picture, for example, you can see that there's a nodule here. So the first symptom is a skin nodule. It looks a little bit like a insect bite, and it's usually on a hand, on the finger, or on the arm. The nodule grows and starts to look like an open sore, and it's slow to heal. So someone may go to a doctor for some treatment, and when the doctor gives him something like antibiotics, it doesn't get better. And then someone who is astute will notice that nodules start appearing almost in a line going through the body. Basically, the fungus follows the lymph channels in the extremities, and it heads, I guess it would be towards the torso. Okay. Now, usually this infection is localized to the skin only, but it can spread to bones, it can spread to muscle, to the central nervous system and the joints. Here's an example of what the lesion can look like if it's left untreated. Pretty gnarly. So, mostly the fungal infection happens during a puncture. Occasionally, people can get a Sporothrix infection by inhaling the spores, and when they do that, they get a pneumonia-like illness. Pneumonia-like illnesses are very common for inhaled fungal spores. Let's talk about systemic mycoses. These are deep infections that involve internal organs or organ systems. Typically, organs like the brain, the lungs, the heart, the spleen, and the kidneys are involved. Histoplasmosis is a fungal infection caused by Histoplasma capsulatum. This is a fungal disease that's found in the central and eastern states of the U.S., states like Tennessee, Kentucky, Arkansas, and Missouri. You also find this infection around the Ohio and Mississippi River valleys. Histoplasmosis outbreaks usually involve activities that disrupt soil, especially soil that's enriched with bird or bat droppings. Examples of these activities might include things like construction, renovation, people going in caves and exploring, that's called spelunking, by the way, farmers tilling soil, or people who maybe keep birds and they've got to clean up bird roosting sites as a result. For most people, especially healthy people who are exposed to the spores of Histoplasma capsulatum, they never have symptoms. Others may have flu-like symptoms that go away on their own. So symptoms like fever, non-productive cough, fatigue, chills, headache, chest pains, and body aches. Typically, these symptoms appear 3 to 17 days after exposure. Now, for some people who have weakened immune systems, or maybe they have chronic lung infections or chronic lung diseases, they may be more susceptible to a more severe disease. For these people, in addition to having the symptoms of the flu, the fungus may actually grow, especially well in their lungs, especially with weakened immune systems. And the fungus may actually spread from the lungs to other parts of the body, like the central nervous system, which can lead to very severe complications. Aspergillosis is a fungal infection caused by a fungus called Aspergillus, and there's a number of these fungi. Aspergillus is a common mold. It's found indoors as well as outdoors. You're probably inhaling spores from the fungus right now, and most people do this daily and don't get ill. But this fungus is an opportunistic pathogen. Those people with weakened immune systems or pre-existing lung diseases, again, like emphysema, COPD, sarcoidosis, etc., they're at higher risk of infection and complications. So this fungal infection, again, is acquired when people kick up dust that contains spores from this mold. There are different types of aspergillosis. One type is called allergic bronchopulmonary aspergillosis, and here inhaling the spores causes inflammation of the lungs, and allergy symptoms like coughing and wheezing result, but there's no infection here. So the fungal spores don't germinate and we don't get fungus growing in the lungs. Another type of aspergillosis is allergic aspergillus sinusitis. Allergic aspergillus sinusitis. So here we've got inflammation of the sinuses, and you get kind of the same symptoms as a sinus infection. Things like drainage, stuffiness, headache. But again, there's no infection. Aspergilloma, on the other hand, occurs in people who have pre-existing diseases like emphysema, tuberculosis, and sarcoidosis. So these three lung diseases can cause people to develop cavities in their lungs. Then when they get exposed to Aspergillus hyphae start growing in those cavities, and it grows to form a ball. And you can actually see these on x-rays. So my arrow is pointing to the wrong thing. It's supposed to be pointing to this up here. Okay, this mass is an example of an aspergilloma. Chronic pulmonary aspergillosis is an infection that causes cavities to form in the lung. It's a chronic infection that happens over several months, and as a result of these cavities, one or more aspergillomas actually form in the lungs. And as you can imagine, this impairs lung function. Cutaneous aspergillosis is a disease where the fungus enters the body through a break in the skin and causes an infection. Alternatively, invasive aspergillosis spreads to the skin, and the result of both of these would be skin lesions. Invasive aspergillosis occurs only in people with weak immune systems. It's a serious infection in which the fungal hyphae begin to penetrate blood vessels and use the circulatory system, basically as a conduit to travel through the body. So this infection quickly spreads to the brain, the heart, the kidneys, and the skin, and possibly the skin, and causes dysfunction of those organs. Candidiasis is a group of diseases that are caused by a genus of yeasts called Candida. These organisms are part of the normal flora. They inhabit the skin, the mouth, the throat, the gut, and the vagina. And typically they don't cause a problem because they're in constant competition with bacteria in the normal flora, and that limits how much these yeasts can grow. But when the environment in the body changes to favor the growth of the yeasts, these yeasts may grow out of control. People at risk for candidiasis include those who are pregnant, those who use hormonal contraceptives, those who have diabetes or have weakened immune systems, as well as those who have recently or are currently taking antibiotics. So, just like with aspergillus, there's a lot of different manifestations of candidiasis, but simply put, it's an overgrowth of yeasts from the normal flora. Some examples would be oropharyngeal candidiasis. You probably know this as thrush, which is depicted here. With thrush, you have white patches occurring in the buccal cavity, on the tongue, on the roof of the mouth, and in the throat. This is accompanied by swelling, redness, difficulty swallowing. There's a cotton mouth feeling and loss of taste as well. Vaginal candidiasis is what we probably know as a yeast infection. Here you've got vaginal itching or soreness. There's pain during sexual intercourse or pain and discomfort when urinating. Sometimes this is accompanied by an abnormal vaginal discharge. So this is just another overgrowth of yeasts. The most severe type of candidiasis is invasive candidiasis. Here, Candida yeast enter the bloodstream, possibly because of a surgery or maybe the placing of a central line or other medical device into the body. So Candida enters the bloodstream. It's usually accompanied by fever and chills that don't respond to antibiotics. There may be heat, swelling, and inflammation as well. And if not treated, invasive candidiasis can lead to organ failure. So this is a bloodstream infection, and it's the fourth most common bloodstream infection in hospitalized patients in the United States. Cryptococcus neoformans, or crypto for short, is a fungus that lives in the environment throughout the world, and for most people it doesn't cause a problem. They never get sick. The people who do get sick from this fungus, though, are those who have become ill or have severely weakened immune systems, like HIV/AIDS patients. Therefore, this is an opportunistic pathogen. People contract crypto when they inhale spores from dust contaminated by wild bird droppings, like pigeons. So remember, histoplasmosis was bats and other birds. Crypto is pigeons and other birds. Again, when people are healthy, they don't usually have symptoms, but occasionally someone who's healthy will get sick, but it's extremely rare. When people inhale the spores, they may wind up with a pneumonia-like illness, which is accompanied by shortness of breath, cough, fever, and chest pain. But for people with HIV/AIDS or people who've received organ transplants or they're on certain cancer treatments or they're taking corticosteroids to treat rheumatoid arthritis or other medications that may weaken the immune system, they may be susceptible to meningitis or meningoencephalitis from this fungus. These two present with headache, and these are extreme headaches, fever, neck pain, nausea, vomiting, sensitivity to light, and most disconcerting, confusion and changes in behavior. So people will go from being alert to zoning out and being unreachable. Unfortunately, if it's left untreated, Cryptococcus neoformans infections for these patients, okay, can lead to permanent neurological damage. The last mycosis that I want to talk about is mucormycosis. And as you can see here, mucormycosis is caused by a number of different fungi. I don't expect you to remember all the names, okay, but you should remember the disease. People contract mucormycosis when they inhale spores that have been deposited on decaying organic matter, leaves, or rotting wood outside. Once these spores are kicked up and inhaled, the fungus then infects the lungs or it can infect the sinuses. This may give symptoms like fever, headache, sinus pain, and cough, maybe even some chest pain. Alternatively, the fungus can enter through a break in the skin, and this could be caused by surgery, burns, or trauma. It can also be spread through fomites in a clinical setting. So most of you don't know me really, but I have a sister, and my sister was an EMT in North Carolina. She then went on to get her paramedic. While she was in paramedic school, she had a case where she had to transport somebody who had mucormycosis. This person had been in a car accident. Basically, they were riding a motorcycle, car hit them, and dragged the rider for several feet. And this person was not wearing proper protective clothing. So they had a really horrible case of road rash where the skin had basically been pulled off of the legs and torso. So my sister goes, provides emergency care, loads this guy up into the ambulance with the rest of her team, and then transports him to a hospital. So while he's there, the doctors clean him up. They debride the wound. They try to get as much debris out of it as they can. They patch him up and they say, look, we want to admit you. We want you to stay in the hospital so we can monitor you for the next few days, make sure everything's okay and that there's no infection. This guy says, no, I don't want to be admitted to the hospital. I want to go home. I have a sister who's a nurse. She can come by and check on me. I'll be fine. If there's a problem, I'll come back. So the doctors have no choice. They let him go home. About 4 days later, this guy gets transported from his home. So let me go back. His sister hasn't heard from him in a few days. So she goes by to check on him. When she finds him, he's in shock. He's not really responsive. Temperature is up. It's an emergency situation. So she calls an ambulance. The ambulance comes and picks him up. They don't take him to the local hospital. They take him to a trauma hospital where I don't remember which one it was, but they basically deal with burn patients. I think the thought was this guy has not been seen for 4 days. He's in shock. He's really out of it. He's having an emergency situation. So they take him to the burn hospital. My sister just happens to be kind of working around that area. And I guess EMT people talk. So she finds out that this guy is at the burn center. She goes down to go check on him. In any case, while she's there, the doctors are like, look, this guy is probably not gonna make it. The nurses are trying to figure out who his next of kin is so that they can call them. The sister's there. She's trying to figure out, get phone numbers together, get everybody to the burn hospital because this guy is in trouble. So because my sister was going for her paramedic, they offered to let her come in and take a look at the guy. So she walks into the ER, and the first thing she notices is that it smells kind of moldy in there. She walks over to the patient. They pull back his bandages that have not been changed in 4 days, and she said it was just all black. Everything in his abdomen was just black. So at the burn center, what they do is they try to clean out wounds, and then, they may leave a patient open, protected as they can, but open so that healing can happen. So that's what they were trying to do with this guy. They had taken out as much dead tissue as they could, but she said everything was black. She could tell he was in trouble because of the moldy smell. And she said that she thought she could actually see the mold in there. That last bit, I don't personally believe, but the moldy smell, I can believe that. So the guy did die. They were trying to get in contact with his parents, get everybody to the hospital. He was dead before my sister had a chance to even leave the hospital. It was just a really tragic situation. But I will never forget about mucormycosis, and neither will she because of it. So this guy got exposed through the road rash. He wound up most likely with blisters, and the blackness that my sister saw that she thought was the mold was likely infected tissue that turns black. It becomes very tender, becomes painful. There's a lot of heat, swelling, and redness that accompanies this. This infection is often fatal if it's not treated quickly, and as happened to this cyclist, the infection can happen to the healthy as well. Part of the reason why this infection can be fatal if it's not treated quickly is that the fungus tends to invade blood vessels and then use that as a highway to move to other parts of the body. So that's mucormycosis. Mucormycosis is the last mycosis that we're going to talk about. As you can see here, it's caused by a number of different molds. And basically what happens is people come in contact with these fungi via their spores. The spores are deposited on decaying organic matter, leaves, maybe rotted wood outside. Okay, and then when the soil and the matter is kicked up, the spores become airborne and they can be inhaled. And the fungus will infect the lungs or sinuses as a result. So symptoms that someone might have include things like fever, headache, sinus pain, cough, sinus infection type symptoms, and lung symptoms like coughing. An alternative method of infection is through the skin. So someone gets a break in the skin either by surgery, burns, or trauma. Sometimes fomites, these are inanimate objects that can transmit disease, okay, in clinical settings. Maybe they've had contact with one of those and they become infected through the skin. Now, I'm going to take a little tangent here. Most of you don't know me, but I have a sister, and my sister was an EMT, and then she went on to get her paramedic certification. So one day while she was in paramedic school, she actually had a run-in with someone who had mucormycosis. So she was driving the ambulance and got a call to report to an accident where a motorcyclist had been hit by a car and dragged for a few feet. When she got there, she administered first aid. They loaded this guy up into the ambulance and took him to the nearest hospital. At the hospital, they tried to clean the wound as best they could. They tried to debride what they could, and they put bandages on. He had wounds to his abdomen as well as to his thighs. The doctors tell this guy, look, we want to keep you. We want to admit you. You've got a lot of wounds on your body, and we want to follow you for a couple of days and make sure everything's okay. This gentleman declines. He says, no, I want to go home. I've had a hard day. I've got a sister who's a nurse. She can come in and help me. The doctor said, look, we need to be able to change your wounds on this schedule, change your dressings on your wounds on this schedule. Can she do that? The guy says, yeah, I'll call her. She can do that. So they let him go with the understanding that he was to come back in a few days so I could check on him. So he goes home and don't know what happens, but he doesn't call his sister. She goes by to check on him a few days later. She finds him sitting in his recliner, out of it, clearly in shock, non-responsive. She calls an ambulance to come pick him up. She describes what's happened, what's going on. They take him, instead of to the local hospital, to a burn center. So at the burn center, they deal with people who have severe damage to their skin. And one way that they treat people is they actually will remove some of the skin and put special bandages over it to allow the skin a chance to heal, minus dead and decaying tissue like skin. So anyways, they're treating this guy, trying to get him all cleaned up. Couple of days pass. My sister is just talking with the other EMT paramedic people, and she finds out that this patient that she transported, a few days prior, the motorcycle accident, has been taken to the burn hospital. So she goes to go find out what happened with him. Well, when she gets there, she finds out that they're trying to find the next of kin. They've called his sister, asked her to come out. They're trying to get in contact with other people because he's about to die. Basically, because she's in paramedic training, they let her into the ER so that she can see this patient. And she says that she told me that they pulled back the dressing. The first thing she noticed when she walked in was the smell of mold. So she goes in, they pull back the dressing, and she said everything in his abdomen was just black, just horribly, horribly black. Now, my sister, in her training, she knows some things about microbiology, but she certainly doesn't know about mucor. So when she saw that black, she thought that that was all mold, and no doubt there was mold there, but the skin turns black during a mucor infection. That's just something that happens. You're not necessarily seeing the mold itself, but you're seeing dead tissue. So the skin blisters, it turns black, it becomes very tender, painful, there's a lot of heat, swelling, and redness. Okay, so anyways, where I left off with the story, they're trying to find this man's next of kin and get them over to the trauma hospital. My sister had a few other things to do, so she went to do them. Before she could leave that hospital, the man had passed away. Really tragic. His family didn't make it in time to see him before he actually passed away. So that's mucor. The infection is often fatal if it's not treated quickly. This gentleman waited to see a doctor. I don't think he intentionally did. I'm thinking that he probably went home being tired after the day that he had, fell asleep. Maybe later that night he went into shock already, or had some other medical emergency and just never left that chair. He could have been passed out. Who knows how long he was unconscious, non-responsive. So infection is fatal. Why is it often fatal? Well, these particular fungi have the tendency to find their way into blood vessels and then use that as a highway to get to other essential organs in the body. Okay. So, although it's rare, these fungi can infect healthy people, like this writer that my sister treated. So that's mucor. So in this video, we've talked about fungal diseases. Remember, fungal diseases generally are called mycoses, and they can be classified a number of different ways: exogenous versus endogenous, superficial versus subcutaneous versus systemic, and then you had the opportunistic versus primary pathogen designations as well. We also went through a number of fungal diseases. These fungal diseases could be on your exam number 2. You might get a story that describes some event that happened to a hypothetical patient, and then you'll need to match that to the diseases that are part of this video. I hope you find this helpful. If you have any questions, don't forget that you can reach me by email, text, or telephone, although I'm not usually in my office, so telephone is probably the least effective way to reach out. All right, I'll see you at the next video.